Often seen as the bridge between medicine and dentistry, oral and maxillofacial surgery is the surgical specialty concerned with the diagnosis and treatment of diseases affecting the mouth, jaws, face, and neck. Board-certified oral and maxillofacial surgeon Dr. Ryan Hambleton tells us about his practice, Highlands Ranch Oral and Facial Surgery.
I work at Highlands Ranch Oral and Facial Surgery. That's the name of the practice. We opened it up in 2018. Our primary emphasis is focused on patient care, customer service. We treat patients that have impacted third molars. We do simple extractions as well. We like to do bone grafting, implants, and sometimes we'll even do orthodontic surgery, pathology, and other types of procedures that fall under the scope of oral surgery. The thing that makes this practice special is the relationship we establish with our patients. Before surgery, I'd like to get to know you and get you to trust me and my staff. During surgery, I want to provide the best possible service. After surgery, I want to reach out to you and make sure everything is running smooth, and if there is any issue, we can take care of it. At Highlands Ranch Oral and Facial Surgery, we offer a wide array of services, including dental implants, bone grafting, and wisdom teeth removal.
Third molars are commonly referred to as wisdom teeth. Dr. Hambleton tells us the importance in the removal of these teeth.
If you do not have enough room in your mouth for your third molars to fully erupt, a number of problems can happen. Impacted wisdom teeth should be removed before the root structure is fully developed. In some patients, it is as early as 12 or 13, and in others, it may not be until the early 20s.
So my wisdom teeth were actually bulging out of my gums, so they had to go.
Some of the possible problems related to not removing your wisdom teeth include infection, cyst formation, possible crowding, and damage to adjacent teeth. With an oral examination and x-rays of the mouth, I can evaluate the position of the wisdom teeth and predict if there are present or future potential problems. The procedure will take about 30 to 60 minutes, and you will probably be in the office for 90 minutes. Recent advances in medicine and technology allow patients to undergo wisdom tooth removal in a manner which promotes rapid healing and minimal postoperative discomfort. State-of-the-art sterilization and infection control techniques are used at all times. The removal of wisdom teeth can be performed under local anesthesia, laughing gas, or IV sedation. Most patients choose to have the procedure done under IV sedation. These options, as well as the surgical risks and postoperative instructions, will be discussed with you before the procedure is performed. Following the procedure, you will be observed in our office until you are ready to be taken home. Upon discharge, your postoperative kit will include postoperative instructions, a prescription for pain medication, antibiotics, and a follow-up appointment in 1 week for suture removal. If you have any questions or concerns, you can call me at any time. I'm here for you.
At first, I was definitely nervous. You know, it's technically a surgery, you know what I mean? So, I walked in and met the guy. He's a really nice guy. The service here is also just as good. He meets you, he sits down with you, he gets with you on a personal level. He really talks to you, makes you comfortable. And from there, he makes the appointment, and then you just go from there. He gets the surgery done. You don't remember much because, anesthesia, but after that, I wasn't in much pain. He gets an excuse to eat Jell-O all week, you know what I mean? So, it was a pretty good experience.
So the reason I chose oral surgery is because our first year in dental school, we were in a class that had us waxing up teeth. And I immediately realized that my waxed up teeth looked like chiclets. They did not look like real teeth. And so at that point, I started searching for something that may suit me a little better. And I just happened to bump into oral surgery. It was interesting. It was a profession that bridged the gap between medicine and dentistry. And the procedures and the type of things that we can do to help patients were very appealing and satisfying.
Restore the beauty, comfort, and functionality of your smile through exceptional care and the latest procedures in tooth replacement and oral surgery. From Highlands Ranch and surrounding areas, patients receive personalized service aligned with their needs and goals for better oral health. At Highlands Ranch Oral and Facial Surgery, you can correct missing teeth and structural issues with confidence.